Sri Lanka. Welcome to the show on a Monday morning, and it's a brand new month as well, the 2nd of December it is, and 2013 has just flown by like that. But you've been with us every morning on Good Morning Sri Lanka, and it's been a great time we've had with you, and we have many more shows. I'm not going to conclude the show right now.
What's it been like? What, 7 months now? Oh, by the way, hi. How's it going?
Yes. I'm Amaya, he's Jason. Good morning
that
to all
thing,
of you.
That whole thing, because I thought it was December, it's a new month, and it's about to start a new year in 31 days.
Wow.
Wait, no, 30. 29, 30. Okay, I'm bad at math. But the point is, I'm not sure what I'm going to do the next year.
Well, you have 30 days to figure it out, Jason.
Yes.
And that's the good news for everyone. I mean, New Year resolutions can wait for just a little bit longer. But today on our show, we're going to start off the month on a bit of a somber note, but nevertheless a very important issue that's affecting everyone around Sri Lanka, especially the youth and certain age categories. We need to speak about these demographics, and today we're going to speak about suicide on the show and the rate of suicide here in Sri Lanka. And to help us do that, we have a very familiar face on our program so far, consultant psychiatrist Dr. Mahesh Rajasurya. Good morning, Doctor.
Welcome back to the show.
Thank you.
Lovely to have you here.
Thank you.
So you're here on the 2nd of December, which is a brand new month, and you're here to speak to us about a very important issue that's prevalent here in Sri Lanka, and suicide is something that many of us are familiar with. But I'm going to start off with the very obvious question of what is the clinical definition of suicide?
Well, you can have very elaborate definitions, Samaya, but if we talk about it in a language that we can understand, suicide is you do something to take your life, and then it takes your life, so you die. So that's suicide. But when you look at it closely, you know, when you look at the people who commit suicide and people who attempt suicide, you tend to notice that they are, all of them are not in the same category, not in the same boat, so to speak. You know, some people do really want to end their life. They are determined to put a stop to their existence. They really want to die. Yeah. But on the other hand, you know, if they are on this end of the spectrum, on the other end of the spectrum, you have people who, you know, who the last thing on their mind is to die. You know, what they want is perhaps to send a message, to protest, or maybe to threaten somebody.
I see. Okay.
Maybe, you know, to get their way.
Yeah.
So they do something to harm themselves. So they achieve whatever they wanted. Perhaps they were not fully aware what they were trying to do. But unfortunately, if the method they used was lethal, they could end up dead. So that's also suicide.
Okay.
But that's, you know, it's a different group of people. So it's actually, if it's a spectrum, people are on this end and this end, but the majority is in the middle.
Yeah.
Okay.
So you have a strong intention to die, but not, you know, completely convinced that you need to end your life. So we get all sorts of people who are towards this end, who really do not want to die. They take a overdose of a medication or some poison, and they reveal that, and they want to go to the hospital, and they want to be treated and saved. So and on this end, you might have people, you know, who really who do things which are really dangerous, like, you know, maybe hanging, violent methods, and they have a higher tendency of ending up dead. So suicide is a diverse phenomenon. It's not just taking your life.
Right. Would you say that suicide could happen to anyone? Like, from your experience, do you think that suicide happens to mainly the lower class, or does it happen to the upper class as well? Because I understand it depends on your environment as well. That brings these problems around in your life.
So each one of us has a risk of committing suicide. How much is the risk is an important question, but the answer is it depends and it changes. It's a dynamic figure that can be given.
All right.
it depends on many factors, and say lower socio-economic classes, the suicide rate may be higher, the rate of violence may be higher, but it's not that simple. You can have pockets of the community where the suicide rate is higher than other areas. For an example, in certain districts of the country, the suicide rate may be high or higher. In certain countries, the suicide rate is high. In certain families, certain subcultures, certain communities, suicide rate may be higher or lower. For an example, in Sri Lanka, the suicide rate is very low in the Muslim community, but relatively higher in Tamil and Sinhala communities.
I see.
So there are multiple, diverse, complex variations. But when we explore how what are the causes of suicide and what we can do to prevent it, we might have a better insight as to the answer to your question.
And there are so many perspectives on this, but at the end of the day, they're all using a means to an end, and it's a very sad end where the country is, of course, losing a lot of resources, human resource that can go forward, and the family unit is losing out. But at the end of the day, I'm going to go on a different tangent here and ask you this question. The individual decides to take his or her own life. So why is it important to prevent suicide? Why should we as a country and a community work hard towards preventing suicide?
Due to multiple reasons. Before answering your question, Amma, let me tell you about the context in Sri Lanka.
Okay.
In 1996, Sri Lanka was the country on the top of the list in the world of the countries of high suicide rates.
Right.
So Sri Lanka had the highest suicide rate perhaps ever in the history of this world, because we don't have any data to say that suicide was very high in the old ages where records were not kept. In 1996, Sri Lanka had a suicide rate of 40 odd people dying out of every 100,000 of the population within a year. That's a lot. 40 odd people dying out of every 100,000 people within a year.
And this is only through suicide. And there are other deaths as well.
Of course, suicide.
Okay.
And and to every suicide, there is maybe 3-4 people who have attempted but survived. So the figure is very large if you look at the people who really attempted it. Now, since 1996, we have a graph on this slide. If you can have that, maybe we can have a look. Since that time, the suicide rate has been declining in Sri Lanka up to now. Each year the suicide rate has been decreasing. So now it's less than 20 people per 100,000 of the population per year that commit suicide currently. So we have been able to bring it down. Why? So your question is why it's important. It's important due to many reasons. One, this is a very accepted, well-known, standard indicator of mental health.
I see. Okay.
The health of the people. If in a certain community, if people are healthy and happy and have a higher level of well-being, the suicide rate should be low. That is one thing. So if you can bring suicide rate down, it indirectly reflects that our mental health is better. The well-being is good. And on the other hand, when people try to commit suicide, they usually end up in hospital first, and then sometimes they survive, sometimes they die. And the country has to spend an enormous amount of money on treating them. And then, as you mentioned, it's the people who are in their prime stages of life that, especially in Sri Lanka, that commit suicide. So you lose them. That's a young age, in other countries, in most of the other countries, suicide has a peak in the older age, 50s, 60s, 70s. But in Sri Lanka, we have two peaks. So there's a peak in 16, 17, 18, 20, 25, that age group.
Wow.
There's a significant proportion of that age group committing suicide than in any other age group, and then we have another peak in, again, as in other countries, in old age. So these people are lost to the country,
Of course.
and that is an economic way to look at this. But if you look at the individual and the the guilt the survivors have, when the person dies, it's not just another death. His or her loved ones might perhaps forever would have this scar in their hearts.
Okay. So far from what I'm hearing, what you just told me is that it's not only if you're a rich person and if you're a poor person, it's if you have health and wealth, you're okay. But even if you're a rich person, it's all these problems that come in. Alright, let me answer this. How do you cure these people from, preventing them from suicides? It's obviously a lot to do with psychology. What's the first thing you would say to a person that says, look, I need help, I feel like, doing this to myself? What would you say to that person?
Your answer to the question you raised is I want to make it much more comprehensive.
Okay.
You started off saying how to prevent suicide, and then the latter part of the question is what to do when somebody is suicidal.
That's right.
Prevention of suicide has two, aspects. One is when somebody is at risk or at a higher risk of suicide, what to do. And on the other hand, what can we do to reduce the rate of suicide in a country, in a region, in a community, in a school, in an area? These are different topics. What scientists have shown again and again is that the most effective aspect or approach is to try and reduce suicide rate in a large community rather than preventing suicide in a single person.
Okay.
Because suicide is an inexact science. We do not know exactly who would commit suicide, why and when. So it's very difficult to predict suicide. Therefore, it's very difficult to prevent individual suicides. There are many things that we can tell to a person who is suicidal, and many ways of help that we can offer them. But let me speak a few words about prevention of suicide on a larger scale, because that is a more effective and proven way.
Okay.
Now, in 1996, Sri Lanka appointed a presidential task force on prevention of suicide, and they kind of forwarded their recommendations to government in 1996, 1997, and since then the suicide rate has been declining in Sri Lanka, and we were the number one. And since then it has been declining. We are still in the top 10 countries in the world, but it's a great decline. It's more than a 50% decline. So we have to take these recommendations seriously. So if you look at these recommendations, it's not about helping individual people, treating them. It's about something completely different. Would you like to guess what were the recommendations? We have to take this recommendation seriously. They were probably effective.
Okay.
We have been able to decline the suicide rate. So, any guesses what these recommendations were?
Reduce unemployment, increase education opportunities.
Jason?
Probably. I'm gonna guess maybe watch something more entertaining.
Okay.
Make life easier to live, right?
Keeping you happy. Keeping you happy.
Let me surprise you. The first, they were given in a different order, but one of the major recommendations was to reduce the lethality of agrochemicals. Right?
All right.
So, one major way of our people committing suicide is ingestion of agrochemicals, right? Weedicides, insecticides. So these were those days in